Welcome, everyone. My name is DJ Wells, and you've tuned into our weekly broadcast, our weekly webinar, Coping with COVID, where each week we talk with you about important issues that are out there facing the world as we all struggle through this pandemic and figure out how to navigate what's going on in the world today. I see participants are starting to sign in, so thank you for joining us. We are joined today by Dr. Janine James, who is a OBGYN, a expert and veteran in this field. And so she and Dr. Mensah will be talking about things that we need to be concerned with as it relates to pregnancy and the pandemic. I want to encourage everyone to send in questions as you have those questions, as you hear Dr. Mensah and Dr. James share with us. If questions come to mind, please do send them in. This is an interactive process, and so we want you to engage and be a part of it. At the bottom of your screen, there should be a tab that says Q&A. If you're watching on a tablet or a phone, it might be at the top of your screen. But either way, click on that Q&A tab, type in your questions, and we will address them as time permits. We're going to let Dr. Mensah and Dr. James chat for about 45 minutes, and then we'll start feeding them some of those questions that you're sending in to us. And so with that, I'm going to hand things off to Dr. Mensah. Dr. Mensah, welcome. Of course, Dr. James, welcome. Dr. Mensah, take it away.
Thank you, Mr. Wells. And first, I would like to thank Dr. James for participating and sharing with us her wisdom and insights. I must clarify a few minor points first. Dr. James is not only board certified in OB/GYN, obstetrics and gynecology, she is double board certified in perinatology. She is a rock star and brilliant, unlike not too many others. So we are extremely, extremely happy that she could afford us some time. Dr. James has practiced in many parts of the United States, tremendous knowledge and wisdom, including teaching a variety of things. Dr. James, for those who may not know, many people know what obstetrics and gynecology is. Could you first share with us just a bit of what perinatology is actually about?
I certainly would be happy to do so. And again, thank you for this opportunity and invitation to meet with you. But perinatology refers to around the time of birth. And that really incorporates pre-gestational, meaning before a person has even conceived. It includes conception, includes pregnancy and delivery, the period of time after delivery. We can consider generally 6 weeks when you're still in a state of pregnancy. And we're even looking as far as 1 year out in terms of the various changes that can take place in a woman's body in relationship to a pregnancy. So a perinatologist is someone who focuses on all of those various stages in relationship to ultimately the birth of a baby, and working also with people who have perhaps medical problems, hypertension, diabetes, cancer, prior to becoming pregnant, people who had some unfortunate events that took place during a prior pregnancy that might have resulted in a preterm delivery or a need for emergency cesarean section or a fetal death, a death of a newborn. So the perinatologist is essentially an internist as well as an obstetrician who has to understand how does pregnancy impact various conditions and how do various conditions impact pregnancy.
Thank you for that education. Many people, I'm sure, are not even aware perinatologists exist until they're kind of forced to go into in-depth discussions around what's going on with the pregnancy itself. Dr. James, we are absolutely delighted to have you here, and we wanted you to share your thoughts with us on what's going on in the field with regard to now the additional layer of COVID and how pregnancy is being viewed, how obstetrics, how even gynecology is being handled at this particular time. Please share with us what your insights are from that perspective. And then perhaps later we'll talk about, okay, well, now I'm pregnant and it's COVID. What do I do? Okay, so please share.
Well, and I'm sure the purpose of our discussion is to be candid, and I certainly look forward to that kind of conversation with you and here in this particular setting. And the reality is there is not much known about what impact COVID has for people who are pregnant, because we don't know much about COVID. Let's be very honest about it. And so we are dealing with each patient individually. There were no protocols or guidelines that were established that would tell you if you have a person who is infected by COVID and who is pregnant, this is what you can expect. And I have even talked to individuals who during this period of time may have considered planning a pregnancy.
Mm-hmm.
And I've cautioned people that if you have an option, this is not the time really to plan a pregnancy, because we don't know what to expect. People are just in the phases of not only being pregnant and delivering, and I've certainly been involved with a number of people who have delivered, but we have to really look at down the road what impact this is going to have. And so that's going to take time for us to understand in the ways that we would like to be able to understand. I think that we've been able perhaps to extract some of our experience with some other viral type infections and apply it to pregnancy. But there is still much that needs to be known. And I think that the conversation that we see within the news media somewhat represents the reality of the confusion about what we need to do from one day to the next. So we're not adequately prepared. I think that we do have the options, or at least as a healthcare society, we have the ability to communicate with some of the other countries to learn from them what the experiences have been. And to some extent that has taken place. But I think that not probably enough of that has happened. And I think we've missed some opportunities very early on to begin the process of data gathering. And as you know, we get the best information on prospective information rather than retrospective, where we're gathering information after the fact. So in terms of really having those kinds of studies where we are evaluating and performing certain steps, it doesn't really exist. And I'd be fooling anybody if I were to say that were the case.
Thank you very much. I appreciate that. And you know, this is the hard part that I think we've seen throughout this whole COVID process. People being candid versus people not being candid and dancing around the issue. And you know, more often than not, I usually tell people I'm a pretty blunt person because these are life or death issues. These are sickness or health issues. We don't have time to really sort of play games around being politically correct or anything else along those lines. Um, Absolutely. In talking to some of my colleagues who are in obstetrician and gynecology, they too are being told, you know what, we're really kind of winging it right now. We're doing sort of the protective pieces around, you know, it's hard, you can't socially distance as a physician very easily. Um, but, you know, we've got this protocol in place and this protocol in place and so forth and so forth. But now pregnancy is another issue. And Dr. James, you brought up one side of the issue, which is planning pregnancies. And I agree with you totally, and I think we all do. It's not a great time to plan a pregnancy. And many people don't understand the true miracle that life is and what must happen if people really knew, as you do, through any given stage of pregnancy. How many millions of reactions must go perfectly well in order to produce a wonderful outcome? Their minds will be blown away. And then there's the other question, though, the other side. There's the plan side, and then there's the question about, oops, gosh, we've been cloistered, we've been kind of secluded, and, well, there's my significant one, and by golly, we interact, and then we're pregnant. So then there's the, okay, it wasn't planned situation. How are we handled, or what are some of the things you would recommend for somebody who recently finds out that they're pregnant? This is the time of COVID, wasn't planned, but you know what? What the heck?
And I appreciate that question, and really the scenario that you're describing represents most pregnancies.
Mm-hmm.
There really aren't that many people who do a great deal as it relates to um, planning for pregnancy. I probably get to see more of those individuals because there is the anticipation of problems based upon our historical experiences. Um, However, uh, things that I would advise someone finding that they are pregnant is understanding some principles that um, obstetricians are familiar with, and particularly perinatologists, or another name for us is maternal fetal medicine specialists, is understanding a very important principle of pregnancy. And that is that one's immune system during a pregnancy is greatly changed
Mm-hmm.
for the purpose of preventing the woman's body from attacking that which is foreign to her. You see, because the fetus is not the mother,
Mm-hmm.
and the fetus consists of cells that are from the mother as well as from the father. And so it is our body's natural tendency to attack anything that is foreign. And so, to put it in as simple a way of looking at this, you have to turn down that immune system so that it doesn't recognize this as these new cells as being foreign and then attack it and kill the pregnancy. Now, it's not selective, that process in fighting or attacking simply the fetus. When the immune system is turned down, the immune system that was so beautifully designed to allow us to fight infection, to survive cancers, is also tuned down. And so a pregnant woman who is otherwise healthy can become so ill, exposed to what ordinarily might be well tolerated. A simple cold is not so simple, perhaps, in someone who's pregnant because her immune system is shut down, and therefore, whatever is considered a pathogen or that which could attack that mother will do so during the course of a pregnancy. So you can have women become extremely ill. So this is really a time to become um, very meticulous, perhaps in some of the ways that we're learning to do as it relates to COVID. I've heard referred to as the 3 Ws, the wearing of the mask, watching your distances, is incorporated in that. What's the third one? There's a third for that W.
Washing your hands.
Washing your hands. Okay.
Oh, Mr. Wells.
Washing your hands, watch your distancing, and wear your mask. Okay. These are habits or activities that are extremely important for pregnancy, but we don't think about it so much, except in the era of COVID. This is extremely, extremely important that you become, you're watching very closely who you're around. And I think that if I were a school teacher and I were pregnant, I would be very uneasy about being in that environment. If I was a healthcare professional and pregnant, I'd feel very uneasy about being in that environment. I would want to be in as sterile an environment as possible to, first of all, minimize my risk of becoming infected. So that's the first point is, and so then what can we do? There are certain things that we can do that can serve to boost our immune system. Things as simple as rest, getting enough sleep, drinking plenty of water, incorporating in our diet, and I'm sure these are things that you can speak to far better than I can, but what are the things that one might incorporate from a nutritional standpoint which serve to boost one's immune system? So these are things that would be important for someone who is pregnant, and staying away from people who are sick so that you're not infected. And if you're not infected, then we don't have to worry about what possibly pregnancy could do to us and what it can do to the fetus.
Dr. James, I'm so glad you brought up the downregulation, as we call it, of the immune system, the cooling it off. Many people don't understand that because the developing fetus is part of you, they don't realize that it's actually not you. The two are not synonymous. So they don't realize that as a foreign body, our immune system is designed to attack it. And so when you have to preserve that pregnancy, immune function for that individual carrying the baby is indeed brought down. And I'm so glad you brought that up. I had to emphasize it, because if someone then gets sick, they don't have that real capacity to put up as an optimum fight against that creature, against COVID or against any other disorder or infectious process. I want to move to a different zone, but before we get to that, in your world, you see tons and tons, of course, of pregnant individuals. In our world, what we see are many patients, and quite a few of them actually say, well, you know, I'm reaching a certain age, or I've had fertility issues, and we are trying to have a baby. We're doing all these things that are involved with artificial insemination, with embryo transfers, with all these things. And I sit back and I kind of go, now? Really? This is not the right time for that. Can you speak to some of those topics? In vitro and embryo transfers and things like that at this juncture?
There certainly has been a great deal of research and work done toward the process of helping people, one, become pregnant and have a baby. And unfortunately, the success of many of these procedures is really not as high as people would like to think. And part of that is that there are multiple factors that contribute to why people, one, do not become pregnant, and two, are not able to hold on to the pregnancy. And what we've come to learn over many years of study, that it can be as much as 40% of the problem being a female problem, 40% being a male-related problem, and the rest could be a combined problem, or we don't know part of this. So it is, I think that so many people feel that if someone doesn't get pregnant, this is a female related problem. And so our procedures that we have put in place, and they are growing, but besides the fact that they are extremely expensive, the success rates are fairly low. And so this is something that I think that it bears at least being aware of, that you don't, and we're talking about social issues when you're saying, well, just get pregnant. Well, there's so many factors that go into that. The mate that you're looking for, your career plans. But we do know that as women age, just as men age, there are a number of health-related issues that come about. And so I think that it would be an extremely challenging time to be in when we're talking about COVID. We're talking about planning a pregnancy. And then we're talking about the issues of assisted reproduction, and what that entails. And what that may entail is someone becoming pregnant, but having a progeny or an offspring that is in some way not normal. And this is another element that I think that most couples are not prepared for, that possibility. So I may be able to help you get pregnant. You may be able to stay pregnant for a while, but maybe you deliver prematurely. So you're dealing with the complications of prematurity. You may be dealing with issues of advanced age and increased um, uh, fetuses that may be affected by Down syndrome or other abnormalities of their chromosomes. And so there's just, it's amazing when we think about how many, as you pointed out earlier, how many factors come to play to even imagine that people can even get pregnant and have babies and that they're normal. There's just, it's almost a miracle.
Dr. James, thank you. Let's move forward on this issue. Someone is pregnant. Now let's talk a bit more about COVID. And this is kind of our world here. All the research that's been done globally. Many of the individuals who are truly stellar in their field, doing a lot of work on this, looking at sort of what we call the pathogenesis, how the COVID creature works. We talk about inflammation that's produced. So there's one variable right away that puts any pregnancy at risk. We talk about the vascular nature. I said a long time ago that COVID is actually a vascular virus. It's not a respiratory virus, it's vascular. Everything it does has everything to do with separating one's ability to have oxygen attached to red blood cells to stay there to the point where it gets to the lungs, and so that it can transfer oxygen and carbon dioxide. That's one part. The virus actually inhibits that from happening, and it does so through an interesting mechanism involving ascorbic acid, or as most people call it, vitamin C. But if you have no oxygen carrying capacity, how do you continue a pregnancy where the baby is looking for your blood in order to survive? That's part one. The other side involves the potential for what we call thrombosis, where blood starts to not only form clumps, but those clumps travel, they can explode, cause damage. And so again, the whole respiratory effort is kind of nixed. Dr. James, I'd like you to talk about and describe the concept of the placenta and what it actually does between the mother and the baby. And then we can superimpose the risks of that from a risk of COVID, revolving around the potential for thrombotic effects and how that would affect pregnancy.
The points that you're raising as it relates to inflammation and thrombosis, the forming of blood clots, is actually for obstetrics an extremely complex and scary aspect because much of what I am involved in is related to preventing the loss of a baby, either as a miscarriage or stillbirth. And when one does a study of those pregnancies from a cellular level or tissue level, you are able to demonstrate a significant component of the effects of an inflammatory process interfering with adequate blood flow, and not only blood, but the nutrients that are associated with that, and gases reaching the fetus. And I am very concerned as it relates to pregnancy management. And you threw out this inflammatory component piece, which we have observed in men and women who are not pregnant. But when we throw in the inflammatory piece into the mix, the concern is that we will probably begin, as we look at our data, observe an increase in fetal loss and infant loss. That is my prediction. So much so that, let's say this fetus survives to later stages of the pregnancy. I really think that we should, especially in those women who have tested positive, that those women have what we call fetal well-being studies for the remainder of the pregnancy. Basically, these are tests that are performed in the doctor's office or hospital that allow you to evaluate the well-being of the baby, so that we, one, are not seeing stillbirths, and two, not seeing an adverse or catastrophic type of event that leads to what people refer to as needing an emergency cesarean section. Generally, the reasons that people need to have an emergency cesarean section is that there is something that is taking place that has the potential of most often harming the fetus. And so I would suspect that as we look at this data a year from now and further, that we are going to see an increased number of miscarriages. We will see that there are going to be an increased number of preterm births, an increased number of people who have increased numbers of people who will have emergency cesarean sections. But I think right now there's too much going on for us to be able to sort this out. But I'm basing these statements upon 40 years of looking at pregnancies. And if my goal is to have a good outcome, I would recommend to the patient I'm caring for, basically, I don't know. I'm going to say that. I don't know exactly what's going to happen. But would you allow me to assess you in greater detail? I'm not saying that something's going to go wrong, but allow me to look in greater detail so that if I have to rescue this baby, and that's part of what we do in maternal fetal medicine, perinatology, that we find that there are occasions where we essentially rescue the babies in the interest of the baby, but sometimes in the interest of the mother. And so that would be among my suspicions or projections about where this is going to lead us. And I think that we have some advantages of extracting, again, that which we have learned in this short period of time about the impact of the inflammatory process, and how that has created some pretty challenging management issues just to prevent the death of the host or that mother.
Thank you. Just in terms of a little background, um, both me and my partner, Dr. Judith Bowman, as family practice physicians, we've done our fair share of delivering babies, of, shall we say, culturing and supporting individuals from pregnancy through to delivery. And so there's a great deal of overlap between the worlds as we look at it from our perspective, from obstetrics to gynecology, infections, inflammation, etc., up through regular medicine and pediatrics. All that's part of what we had to do in our residency programs and beyond. And so when we look at this phenomenon, I also want to make clear, many people may not understand maternal fetal medicine. You mentioned it as the other name for perinatology. But I want to share with the folks out there for a moment, kind of where you guys come into play. So if we are moving through a gestational process with a patient, and there's some severe challenges going on that are above and beyond, we call people like you. We bring in what we call MFM, maternal fetal medicine, to deal with these really, really, really tough issues. So for those of you listening out there, this is one tough lady, one experienced doctor. And she is a super specialist. I want you to understand that. What she does is she's like the SWAT team for the police department. She's like the Marines for tough cases out there in the world. So these are powerful comments that are being made, and I need you folks out there to understand this is not just someone's perspective here. This is not only tons of training and education, but decades of personal experience that are going into these comments. I want to talk, so thank you very much, Dr. James, again. I want to go back to this idea. When we talk about the COVID-19 virus, and we see now that there are often neurological deficits that happen in not just adults, but children. We talked about the vascular nature, but as you said, we really don't know what this will happen or what this will do to the developing fetus. Negative outcomes, as you said, you would anticipate probably they will increase. But when we look at afterwards, the child makes it through, and if they've had this viral exposure, we don't know yet what it does to brain development. We don't know how that could hinder, how that could cause problems with the neurological side of things in development, let alone we know that individuals who've had COVID who are not pregnant have had thrombotic issues and lesions such that they've had to lose limbs. And I harp on this because pregnancy is so dependent on the oxygenation of that baby, of the connection between mom and child, and having an appropriate vascular system for that connection to take place. And this is one of the really tough pieces where the virus works its negative and most negative work in that vascular connection. So some of the things that we could potentially see with pregnancies could be the destruction of the placenta in terms of thrombosis and things along those lines, neurological deficits for the fetus, general inflammatory challenges, growth retardation. There are a lot of really serious consequences that can be involved with pregnancy at this time. So it's a very serious topic that we're looking at here. And I want folks to understand that it's not pregnancy and, oh, just a cough or a cold that we're talking about, okay? This particular situation can truly be devastating in many ways, shapes, and forms. You make it through, as you said, Dr. James, you make it through the pregnancy, and then there's some type of really negative outcome where the child is alive, but not necessarily what most people would call normal. It may be a huge challenge to care for after that. So it's one of those things that we have to really be cautious about and think to our best about how we even protect ourselves at this point in time. Maybe we should look for the next few months, families who are, there and just kind of bored and they choose to engage in joining and intercourse and so forth, maybe utilizing protection until we're in a better space for pregnancy risk. What do you think along those lines?
I think in an ideal world, yes. As we were saying earlier, this really is not the time, with so much weight on our offsprings. This is not the time to go in that direction. It's a time that I would certainly, for those people who ask me the question, who aren't already pregnant, I would tell them, do all that you can to prevent a pregnancy until we can learn some more about this. Because waiting may make the difference in terms of what not only you as the mother faces, the family faces, but ultimately the child may face. And I think Dr. Mensah, you and I here in this space are really in a very exciting space from the standpoint of being able to report these concerns. Certainly in the work that you do, you are seeing the after effects of pregestational pregnancy. Some things we know about, some things we've come to learn that, of course, you share with your patients. But we recognize that there is a cause and effect. We don't always know what the cause is, but we are faced with the effects. And so if one were to learn that there was something that could be done to prevent growth restriction, something to prevent a death of a baby, something that could prevent autism. These are not the worst things in the world, by no means. But if we had the ability, just like any product that we were making, we would want to look at any deficits, blemishes. Is it possible? If it's possible to prevent or control some of those things, obviously we would want to do that. And so I think that we really need to have a plan that allows us to study not only the individuals who have been infected, but certainly for the babies who are born, to look to see how are they meeting their developmental milestones? Are they walking at the time that they should be? How are they faring? And by doing so, it may allow us to intervene and adjust things that may help in the long run make a difference. And I come from a very interesting perspective, having delivered babies for more than 40 years. I've had the opportunity to see those babies become adults.
Mm-hmm.
I've had the joy of seeing them become parents, and I have had the beauty of seeing some go on to medical school. And I even have a baby who is the lieutenant governor of the
Yeah.
state of Wisconsin.
Yes. Yes. I was going to
And
bring. You didn't. You had that great opportunity. Yes.
so I really have some thoughts when you're talking about from the perspective of being involved with a family and a parent pre-gestationally, throughout a pregnancy, throughout its upbringing, and to see where that can lead us, that gives me extreme feelings of joy, um, where that's illustrated the work that goes into what's going to be the outcome, what's the result of this. And I think that there are some of your patients, some of your friends who really would be interested in what does it take to take us to not only just I had a baby, it survived, but is this a good citizen? Is this person healthy? Is this person productive? Are they able to do their use their intellect to its maximum? That is extremely exciting. You're not manufacturing it, but what do we need to do to support it? If it means that I need to drink 10 glasses of water a day and it'll get me this versus that, let me know that. And I can make that choice if this is what I feel needs to be done. What are we going to do? And I think this is where we've struggled, particularly in this country, um, in terms of recognizing really what goes into the making of people. And there's so many factors that go into it. So I think we have an opportunity to work with educators. We have the opportunity to say, let us study very closely what impact this exposure may have had, and how can we intervene early in such a way that that individual is not severely impacted down the road.
We had absolutely, Dr. James. We had a young lady I was speaking to the other day, and most of these folks who would become pregnant, shall we say, it would not be first timers. They've got toddlers, they've got older children who are now in the school system, who are now being exposed to all these viruses, bringing it back home. And one question, I've got a couple I want to ask you, but one question people might ask is simply, should I breastfeed given these exposures at this point in time? And perhaps before we answer that question, one question that was brought to me was, should we have pregnant women tested for COVID? Let's start there.
Absolutely. I think the knowledge, all right, I may not know what I'm going to do with the information, but I think that it makes all the sense in the world to test. And barring false negatives and false positives, but I mean, go through the exercise, because I think that down the road, this information will prove to be helpful, and it is worth at least knowing that. And we may test a lot of women, and we may find a lot of them are going to do just fine over a period of study. You know, in the terms of life, 10 years, 20 years is not anything
Mm-hmm.
in terms of what we can learn from that. In fact, this COVID bit, and I've told people this, I've had uh, I guess, the benefit of having relatives who lived into their 90s. And as such, I have family members who were alive during the last pandemic. We had 8 children in the family, and I always wondered, well, what happened to 3 of those children? And my grandmother told me, who at the time was 19, said that 3 of them died as a result of the pandemic.
Hmm.
She didn't know to call it a pandemic. After I later went to medical school and I did reading about this and learned that at least a third of the world's population died during that pandemic, that there were few families that did not suffer a loss throughout the entire world as a result of that pandemic. So I became very impressed that that's some serious business. And in this case, these were 3 little children who
Hmm.
died. So there were things, I'm sure, that were learned during that experience, but um, let's learn from their experience to gather as much data as we can.
I think that's
And
an. Yeah, sorry, go ahead.
so that we can use that to prepare for, we can expect there'll be another pandemic, but hopefully we will be better prepared.
I think that's an excellent idea. Um, the folks that we've been working with globally, we're all very obsessed with the here and now and dealing with pathogenesis, how this thing works, how to find treatment, et cetera, et cetera, where we may be losing sight of some very important demographics. And I don't want to say demographics because these are people. These are people who have lives, who are relevant. As you said, you know, you delivered a lieutenant governor, you've delivered multiple physicians, you've delivered attorneys, I'm sure you've delivered all sorts of wonderful individuals. But what if they had been way back when someone affected by some disease or some disorder and they didn't make it? Look at the domino effect down the line of who would not be influenced or helped by that one life. And that's why I've said repeatedly on these discussions, look, in terms of what we look at as physicians and at Mensah Medical and at institutions all over the world, we have a 0 fatality tolerance rate. We understand, that's why most of us are physicians, we understand the value of one life. We've become so numb to say that, well, you know, there have been 1,600 people who died today, and so now the percentage is this, and blah, 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 et cetera, et cetera. So wait a minute, 1,600? One person is currently serving a certain office, whether it's mayor, governor, or whatever have you. That one person gone changes the entire dynamic of a future for an entire society. Okay,
Yeah.
one life is serious, and I think because of our extreme focus, we might be missing this opportunity to follow those women, Dr. James, who have delivered babies or who are pregnant at this point in time. And I think that would be fabulous to now look at studies where we determine we're going to follow this cohort. We're going to follow these lives to see how they progress, what kind of challenges they may or may not have. And so the next time, because at some point there will be another one of these things. Okay, that's just history. That's just the cycle of life. We might be better prepared to deal with it. We might be able to actually save more lives because of what we learn at this point in time. So I want to thank you for all your wisdom, Dr. James. I want to thank you for sharing that and your expertise with us. I want to make sure we have opportunity for questions. So Mr. Wells, do we have any questions that have come in for Dr. James?
We do, and actually, one of our earliest questions, Dr. James actually kind of answered as part of her responses to your questions, but I do want to acknowledge that question. Someone who asked, do pregnant women need to be more stringent about social distancing while carrying? And of course, Dr. James, you mentioned that you want to be in as sterile an environment as you possibly can be. So we've already addressed that question. You started to talk about nursing, Dr. Mensah, and whether or not pregnant women should nurse. And so one of the questions that came in was, can nursing mothers pass on COVID in their breast milk, or do we even know? And if not, how can a mother nurse safely without fear of passing on any sickness she might have because the baby's so close to her?
This is a question that often comes up in terms of the safety of breastfeeding. And again, we're in a situation where we don't really know a lot of the answers to these questions. I can tell you that for the most part, breastfeeding, the benefits that are gained from breastfeeding exceed even the potential risk. To be able to pass on some of the antibodies and immune factors from the mother's exposure to infections to the fetus are a positive. The social as well as the neurological benefits of the interaction between the mother and the baby, these are all positives. But I could also appreciate a woman saying, I'm afraid. If I'm positive, I'm afraid if I'm positive to breastfeed because we don't know down the road what the impact would be. But I would feel under those circumstances, really, it's very difficult to social distance from your baby.
Yes.
So, I mean, you got to feed it, you got to change it, and unless you're going to hand that responsibility totally off to somebody else and miss that experience, I don't know that we have that kind of an answer or those kind of recommendations. And I think that even uh, where we find that there may be the virus within the breast milk, is this going to result in infection for the baby? We don't know all of those answers. So I think that we're basically in a position of being very candid, or we should be, of being very candid with the families, sharing with them that we really do not have all of these answers, and that we take as much precaution as we can. And so you could wear a mask and you can wash your hands, but you can't really social distance from the baby unless you give the baby to somebody else to take care of. That's not a real viable way of going about doing things. So I think that we make the precautions the best that we can. And I've often said this to patients that I've cared for. If I'm giving you a recommendation, I might be overdoing it. And we may come back a year from now and say, we didn't need to wear the mask, we didn't need to social distance, we didn't need to do this. This has attacked us from a different way than we thought. But I think that some of these things that we're asking people to do, at least in my mind, are small sacrifices
Mm-hmm.
when we
Absolutely.
look at the big picture. And so my goal is, and I've said this to people who said, "Oh, I want my child to go to that birthday party." Well, hopefully they're going to live, and they're going to go to a lot of birthday parties. I'm not going to go to that wedding. I'm going to have to do a virtual wedding, but I want there to be lots of years to come for us to enjoy weddings. But if we've overdone it, so be it. It's not going, these things are not going to hurt us. And in terms of ultimately looking at our survival,
Mm-hmm.
and I want us to survive, and whatever we think might work that is unreasonable to allow us to survive.
Better to overdo it than to underdo it.
Yes.
Because
Absolutely.
underdoing it has some serious consequences.
Absolutely.
Thank you, Dr. James. That was awesome. Mr. Wells, any
Uh,
other
ju-
questions?
yeah, just a couple more. One that came in asks, the CDC just recently changed their guidelines about COVID reporting,
Mhm.
saying that people are dying of their pre-existing conditions and not from the virus itself. Should we be able to translate that to say that healthy expectant mothers, mothers who come in without any pre-existing conditions, are in less danger than mothers that might have had some other conditions prior to pregnancy?
Um, I think that that question, while a good one, um, may be extracting some information that I don't think that we're prepared to back up at this point. Um, to say that people are dying because they have a pre-existing condition, we know that there are people who have, at least as well as we can determine, were normal and died, who
Yes.
had COVID. Now, we may find with further investigation that there were individuals who had some other subtle problems that were brought out under the uh, exposure of the COVID infection. But there are young people who did not have chronic conditions, who who were not smokers, who didn't drink alcohol, but they have died. So yes, there is a predominance of people who had these other conditions and didn't do well with COVID. But for us to say that normal people don't die, that data is not there. And
I
so
would
I
also
would not say that for pregnancy.
like to mention what Dr. James said earlier. When you become pregnant, your immune system takes you to a place really as though you had a pre-existing condition, but it's a new existing condition that weakens your ability to fight off infections. So you are, at least logically and in theory, more susceptible to illness. You know, I remember seeing quite a few women who had colds throughout their pregnancy. They were miserable. There are a lot of women who didn't. Why did one group have that and why did another group not? But immune compromise, actively so generated by the human body once pregnancy happens, is a big problem. And so if you're thinking about becoming pregnant and saying, well, I have no pre-existing conditions, you're about to have a post-existing condition, okay? You're going to be developing one, and you have to protect that space that baby that's developing, and you have to protect yourself. Because in our world, we know that once pregnancy hits, it zaps you of zinc, which is one of the keys to immune production, to immune system functioning, optimizing that. And that's because baby needs the zinc to grow. Baby needs a lot of things from a molecular perspective, a nutritional perspective, in order to not only survive, but to thrive. Unfortunately, well, now it gets it from mom, which is what it's supposed to do. But now that also depletes mom, the person carrying the baby. So please understand, it is not a situation of, well, before I got pregnant, that indicates how I'm going to do during pregnancy. It is a help to be as healthy as possible. But once you become pregnant, a whole lot of other things change within your own physiology in order to allow your child to survive. A lot of personal sacrifice happens with the mother. So I want folks to keep that in mind as well.
The last question we have here actually speaks to something that you were just saying, Dr. Mensah, the depletion of zinc in pregnant mothers. And so one of our viewers has asked, what nutrients should an expectant mother be taking above and beyond normal prenatal vitamins to protect themselves and their babies from COVID?
Well, now that's one of those really dainty, delicate questions. As a matter of fact, Dr. James and I were talking about the folic acid issue earlier today, and we referenced the whole concept of folic acid throughout the first trimester of pregnancy. But there are a tremendous number of other factors that come into play where we have to say you have to be cautious of a general multivitamin. You have to be cautious of dosing. What an individual who's an adult can take for health or take for cognitive issues. Somebody who's got anxiety or depression, like a tremendous number of our patients, or bipolar or schizophrenia. Those kind of treatment levels of nutrients really cannot be taken during pregnancy because we don't know what they would do to the developing fetus. There is tremendous power in methylating agents like folic acid, like methionine, like SAMe. And when I say methylating agents, I mean just that. The agents that literally affect DNA and genetic expression, okay? So taking them for prolonged periods of time is problematic. Taking too high of a dosage, we don't treat children with the same dosage that we treat adults. And there have been no studies on babies or in utero constructs because, quite honestly, we would find that rather ethically challenging. You do not want to put a child at risk. So we talk about nutritional levels of certain nutrients. Yes, things like zinc, vitamin C, vitamin D, for the first trimester, folic acid, certainly, and a few others. But don't go overboard and try to take higher dosages than what the recommended daily allowance would really indicate for a pregnant person. Caution, caution, caution. After the pregnancy is over, if you're not breastfeeding, that's a different story. But even if you're breastfeeding, you have to be cautious to not take in too much of a high dosage of any given nutrient. And that's a challenge many people have because for them, they're already on a nutrient program, used to taking therapeutic levels of zinc and vitamin B6 and vitamin D and so forth. But you can't do that exactly once you're pregnant. You got to be cautious of the baby as well. So that's when we kind of bring it back down to the RDA, recommended daily allowance, that is felt to be safe and secure from a traditional medical perspective.
Very good. Well, that's all we have in the way of questions. Dr. Mensah, Dr. James, any closing thoughts before we wrap this up this evening?
Dr. James?
I am so excited that you have created this forum to allow for this type of conversation. It's extremely difficult with all of the media that's more general, but I'm glad that you have created an opportunity for us to talk about some of these, and I encourage you and to do more of that. because I'm sure your listeners will greatly appreciate it.
And Dr. James, thank you so much, not only for the commentary, but for spending time with us. I know you're extremely busy. You've operated between multiple sites and states and institutions, and I know your time is precious, so we want to thank you. But I would like to ask you, we are hopeful that we will be, again, able to tap your expertise and your knowledge bank at another one of our conversations, because pregnancy keeps coming up as an issue, and your enlightenment would really be beneficial for all of us. So we want to thank you, and hopefully we'll get to talk again.
Thank you again.
Very good. And thank you, all of you who've tuned in. Thank you for watching and spending time with us today. I want to remind you that shortly after we conclude this, in just a few minutes, we'll be uploading this video to YouTube, to the Mensah Medical YouTube channel. And so we encourage you, if you missed some of the broadcast, if you want to go back and revisit some of the outstanding information that was shared today, go to the Mensah Medical YouTube channel and you can find the video replay of this entire broadcast there. We will also post links to the video to the Mensah Medical Facebook page. And of course, we encourage you to tell your friends and family and colleagues about this conversation so that they can tune in and take a look and benefit from Dr. James and Dr. Mensah's incredible information that they've shared today. We encourage you to join us again next week and in the weeks to come as we continue to talk about important issues as they relate to coping with COVID. And until then, we'll see you next time. Thank you so much for joining us, and stay safe and stay healthy. Thank you, Dr. James and Dr. Mensah.
Thank you.